Hi everyone, Elizabeth here. Today we are going to be doing a standard 3-vector lift. We are using 17 gauge threads, AAFE, and this video here is actually going to be a great example how sometimes the AAFE 17s can be a little bit tricky to use versus, for example, using a 19 gauge thread. So, the thicker the gauge that we're using, the more difficult it's going to be to get it through the tissue. So I'm going to go ahead and just discuss a few different tips and tricks throughout this video that I utilize just to make the treatment a little bit smoother and make sure that I am still at the proper depth and having a nice placement of the threads. So like I mentioned, if you're using a smaller gauge, like a 19 gauge for example, it's going to be easier to navigate through that tissue because it's, thinner. So the wider we get with that gauge, of course we're going to get a better lift because we're placing that thicker thread, but it can be a little bit more difficult as a provider going ahead and placing that. When we're using a 17 gauge thread, we are getting a better hold and a stronger lift just due to the thickness of the thread. Also, the 17 gauge threads have a larger anchor at the bottom. As we're going through here and placing, I will try to point that out. But I also have a couple tricks just to get that to engage where you want it to engage at the bottom of your vector. They can be tricky, but that's what's going to overall give you the best result. So going in here, we're just numbing with some 2% lidocaine. I'm using a 22 gauge cannula here and just placing a little bit of lidocaine. This patient has had threads before, actually twice before this. So she's very used to this treatment. Of course, it's not, painless. You can see her flinching a little bit here, but overall it's relatively comfortable. It's nothing, it always looks a little bit scarier than it actually is. I always have patients come in, they're researching threads, which, I love when patients come in educated about what they're getting done. But sometimes they say, I watched this video and it looks, terrifying, but I promise it's not as bad as it looks here. It's actually relatively comfortable. But right there on the end of that thread, you could see that little anchor popping out. So that's what I was kind of speaking on when I was talking about sometimes that bigger anchor is a little bit harder to get to engage. So once I'm to the bottom of my vector here, I like to place my hand over and just do like a twist. Sometimes I end up going like 360 all the way around. It kind of just depends, but I place my hand there and just do a little twist kind of back and forth, very gentle, nothing crazy, just until I feel it pop into place. Then I go ahead and retract back. You're going to go ahead and see me do that exact same thing here. So I'm always checking, making sure I like my depth. And again, I'm going to place my hand very gently over the bottom and just do, a little twist, make sure I like my placement, and then pull back. You'll almost feel it pop into place underneath that, we can call it a smart hand that you're using to kind of just feel your depth as you're going through. This is going to ensure that you're not pulling back that thread and then it's engaging halfway up your vector, because then obviously you're not going to be getting as good of results. We want to make sure that we're grabbing that tissue all the way at the bottom of that vector. So again, we're going to go in here and do the same exact thing. So I'm just using one hand to kind of guide my placement. She's had 2 thread treatments previously, so she has a very nice collagen. So you can kind of see I do like a little twist kind of back and forth and almost curtain over curtain rod and place that tissue on top of my cannula. Again, always checking and making sure that I like my depth. Again, removing, and here I'm just doing a little, you kind of see I just wiggled that cannula back and forth a little bit just until I felt that pop, and then go ahead and remove. So here we are with our 3 vector. I pull back slightly just to make sure everything is nice and engaged, and then we'll go ahead and cut our threads. You can see I have like a little pucker right there. Not that big of a deal, you want to see that. We're going to go ahead and just smooth that out here momentarily. I like to clean over my insertion site just one more time with an alcohol swab, just to make sure everything is nice and clean and make sure all of my threads are nicely engaged. We'll go ahead and throw a band-aid on there and we'll do the same thing for her jawline. And here we can just like appreciate her lift side by side. She got a really nice lift on her cheek especially. But now we're going to go ahead and choose our jawline vector. So I'm just going ahead and choosing my placement here and placing a little bit of lidocaine with epi. I like using epi at that insertion site just to help control bleeding a little bit. I ended up going slightly behind because she did end up bruising right there, and I didn't want to go straight through it, but I just moved it slightly back. And now we're going to go in and make our pilot hole. Another trick you can use if you ever are questioning your depth, you can throw a 3cc syringe onto the end of your thread. So for example, here I have a 3cc on the end of my cannula. So if you just imagine that that cannula is the thread, you want to lock that thread into place with your 3cc, and that way you can kind of navigate your thread around a little bit. If you're using the thread without anything on the back and you pull back, it will engage. So if you were too superficial and you went ahead and pulled back, it's going to engage too superficial and you're going to be able to see it. So never hesitate to go ahead and just move that thread around a little bit. It's going to be short-term discomfort for the patient during the treatment just to go ahead and change your depth versus leaving it and having that patient have a superficial thread, for the duration that that thread is going to last. So always, take your time, make sure you like your depth, make sure you have a nice smooth vector all the way across before you go ahead and remove. There's no harm in backing up a little bit and correcting your depth. Like I said, short term, discomfort, the patient's numb at this point. Oh, this is actually a perfect example. I went ahead and tossed my 3cc right onto the end. I was just slightly too superficial right by the corner of her mouth. And again, short-term discomfort, and you saw she flinched a little bit, but I didn't want her to be able to have any risk of seeing that thread after the treatment. So never hesitate to go ahead and just throw that on there. Again, I kind of did a little twist just until I felt it engage. I really only do that with the 17 Arte 3s just because I find, like I said, that anchor is just a lot bigger, so sometimes it doesn't like to engage all the way at the bottom. So I just do that little kind of twist just to make sure that everything is engaged. And there we go, that is one side versus the other.